Hi, I'm Virgin Grace B. Cristobal, and today we will talk about adrenergic drugs and its classification based on its mode of action, as well as the pharmacological effects of sympathomimetics. Adrenergic drugs are medications that stimulate certain nerves in your body. They do this by either mimicking the action of the chemical messengers epinephrine and norepinephrine or by stimulating their release. It is classified as direct, indirect, and dual acting based on its mode of action. Direct acting adrenergic agonists are compounds that directly bind to and activate adrenergic receptors. These compounds can display a high degree of specificity for particular adrenergic receptor subtypes. The indirect acting drugs do not bind to specific receptors but act by releasing stored norepinephrine. This means that their actions are non-specific. Mixed-acting adrenergic agonists are compounds that cause activation of adrenergic receptors by both direct binding as well as release of endogenously stored norepinephrine from presympathetic terminals. Sympathomimetic drugs, also known as adrenergic drugs and adrenergic amines, are stimulant compounds which mimic the effects of endogenous agonists of the sympathetic nervous system. Examples of sympathomimetic effects include increase in heart rate, force of cardiac contraction, and blood pressure.